Have you ever been fast asleep when suddenly your calf tightens like a knot? The pain is immediate. Your foot pulls downward, your leg becomes difficult to move, and for several seconds, or sometimes several minutes, it feels as though the muscle simply refuses to release. For many people over 60, this happens once in a while. For others, it happens several nights a week. And the most frustrating part is that they are often told, "It's just your age. Drink more water, eat a banana, take more magnesium." But leg cramps are not always that simple. Some happen because a muscle was overworked. Some may be connected to dehydration, medication, or reduced mobility. Others are not ordinary muscle cramps at all. Pain that appears every time you walk may be a warning that your leg muscles are not receiving enough blood. And pain in one swollen, warm leg may indicate a blood clot that needs urgent medical attention. Today we are going through 7 possible causes of leg cramps, beginning with the common and usually harmless explanations and ending with the warning signs you should never ignore. After each cause, I will explain what you can safely do and when it is time to speak with a healthcare professional. Stay until number 7, because knowing the difference between a common nighttime cramp and a dangerous circulation problem could protect far more than your sleep. Before we begin, remember that a true muscle cramp is a sudden, involuntary tightening of a muscle. It most commonly affects the calf, although it can also occur in the foot or thigh. It may last from a few seconds to several minutes, and the muscle can remain tender afterward. Most leg cramps are harmless, but recurring cramps accompanied by weakness, swelling, redness, or skin changes deserve medical evaluation. Let's begin with one of the most common explanations. Number 7, muscle fatigue or sudden overexertion. Imagine that you normally walk for 15 minutes a day. Then one weekend, a friend invites you on a long hike. You walk up hills, climb stairs, and spend several hours using muscles that are not accustomed to that level of activity. That night, you wake with a severe calf cramp. In many cases, the explanation is not a mysterious deficiency. It is fatigue. When a muscle is pushed harder or longer than it is prepared for, the nerves controlling that muscle can become more excitable. The muscle may then contract suddenly and struggle to relax. This can happen after a long walk, gardening for several hours, standing all day, climbing more stairs than usual, beginning a new exercise routine, or exercising in hot, humid weather. Age can increase the likelihood because we gradually lose muscle mass and conditioning unless we actively work to preserve it. A less conditioned muscle reaches fatigue more quickly and may be more vulnerable to cramping. So what should you do? First, do not conclude that physical activity is dangerous. The answer is usually not to stop moving. The answer is to increase activity gradually. If you have been inactive, begin with short, comfortable walks and slowly add time or distance. Warm up before demanding activity. Avoid suddenly asking your legs to perform 2 or 3 times more work than usual. During an active cramp, gently straighten your leg. Pull the toes toward your shin if you can reach them safely. Massage the tightened muscle. If you are steady on your feet, stand carefully and place some weight on the affected leg. Stretching and gentle massage may help the muscle release, although most cramps eventually stop on their own. Afterward, the muscle may remain sore for several hours. That does not necessarily mean anything has been damaged. But if the cramp repeatedly appears with ordinary activity, causes weakness, or becomes progressively worse, do not simply blame exercise. That brings us to cause number 6. Number 6, prolonged sitting, poor conditioning, and tight calf muscles. Your muscles are designed to contract, lengthen, and move throughout the day. But modern life often keeps the legs in one position for hours. You sit while watching television, you sit while driving, you sit at a desk, you sit during long flights. And when the ankle remains in the same position for long periods, the calf muscles can become stiff and shortened. At night, the foot naturally points slightly downward beneath the blankets. That position shortens the calf even further. For a muscle that is already tight, this may make a nighttime cramp more likely. Holding one position for a long period and poor physical conditioning are recognized contributors to muscle cramps. Regular calf stretching may reduce how often some people experience them, although it will not prevent every episode. Here is a simple routine you can try. Stand facing a wall. Place both hands against it. Step one leg backward while keeping that heel on the floor. Keep the back knee straight and slowly lean forward. You should feel a gentle stretch through the calf, not sharp pain. Hold it briefly, relax, and repeat. Then switch sides. You can perform this during the day and again before bed. Support yourself with a stable surface, especially if your balance is uncertain. Another useful habit is to move regularly. If you have been sitting for an hour, stand up. Walk around the room. Move your ankles up and down. Circle your feet gently. These movements are not a guaranteed cure, but they help prevent the legs from remaining rigid for long periods. Some people also find that a few minutes of gentle walking or light stationary cycling before bed helps their legs feel more relaxed. Mayo Clinic lists stretching before bedtime and light exercise as measures that may help prevent nighttime cramps. But suppose you are already active and flexible, yet your cramps appear after working outside on a hot day. Then we need to consider number 5. Number 5, fluid loss and dehydration. Dehydration is one of the first explanations people mention when discussing cramps. But we need to be precise. Not every nighttime cramp means you are dehydrated, and drinking enormous quantities of water is not always the solution. Dehydration becomes more plausible when cramps appear after heavy sweating, prolonged exercise, hot weather, vomiting or diarrhea, fever, or inadequate fluid intake throughout the day. When you lose fluid, you may also lose electrolytes involved in normal nerve and muscle function. This combination may make cramping more likely in some situations. Older adults can be especially vulnerable because the sensation of thirst may become less noticeable with age. Some people also intentionally restrict fluids because they do not want to make repeated trips to the bathroom. The solution is steady, appropriate hydration, not forcing down liters of water immediately before bed. Drink regularly during the day. Increase fluid intake appropriately during hot weather or prolonged activity. Pay attention to thirst and urine color, and replace fluid after significant sweating. However, people with heart failure, advanced kidney disease, liver disease, or a medically prescribed fluid restriction should not substantially increase fluid intake without professional guidance. The amount that is safe for one person may be inappropriate for another, and please do not assume that every cramp means you need more salt. Increasing sodium indiscriminately may be unhelpful or unsafe for people with high blood pressure, heart failure, kidney disease, or certain medications. Leg cramps are not a reliable home test for sodium deficiency. The NHS lists dehydration as one possible cause of cramps, but many cramps still have no identifiable cause. Before buying electrolyte powders or supplements, ask, have I actually been sweating heavily? Have I had vomiting or diarrhea? Am I taking a medication that changes fluid or mineral balance? Do I have a condition that affects my kidneys or heart? That last question leads us directly to number 4. Number 4, medications or a true mineral imbalance. Muscles depend on a carefully controlled balance of minerals, including potassium, calcium, and magnesium. If that balance becomes significantly disturbed, cramping can occur. But this does not mean everyone with leg cramps has a mineral deficiency, and it does not mean everyone should start taking magnesium, potassium, calcium, and salt together. The body controls these minerals within narrow ranges. Too little can be dangerous. Too much can also be dangerous. Potassium is particularly important because an excessive amount can disturb the heart's rhythm, especially in people with reduced kidney function or those taking certain blood pressure medicines. A true imbalance may occur because of heavy fluid loss, kidney problems, persistent diarrhea or vomiting, poor nutrition, or medicines that change fluid and mineral levels. Some medications have also been associated with muscle cramps or muscle symptoms. Examples can include certain diuretics used for blood pressure, some cholesterol-lowering medicines, and several other prescription treatments. The NHS specifically identifies statins and diuretics among medicines that may sometimes be associated with leg cramps. But this is where viewers must be careful. Do not stop a prescribed medicine suddenly because you heard its name in a video. Stopping blood pressure treatment, cholesterol treatment, antidepressants, or other medicines without guidance may create a greater danger than the symptom you are trying to solve. Instead, prepare for a medication review. Write down when the cramps began, how frequently they occur, whether they started after a new medicine, whether the dose recently changed, whether the cramps affect one leg or both, and whether you also have weakness, dark urine, swelling, numbness, or skin changes. Bring that information to your doctor or pharmacist. They may review your medication list, check for interactions, or order blood tests when appropriate. Do not assume you need a supplement without knowing whether a deficiency exists. A bottle labeled natural can still interact with medications and can still produce harmful amounts of minerals. The safest message is simple. Suspect the pattern. Document the pattern, then have the medication and your health conditions reviewed. Let me ask you something. Did your cramps begin after starting or changing a prescription? Think carefully about the timing. And share your experience in the comments without encouraging anyone else to stop their medicine. Your pattern may help another viewer recognize that they should request a proper medication review. Now we move from muscle chemistry to the nervous system. Number 3, nerve compression or lumbar spinal stenosis. Not every painful tightening in the leg begins inside the muscle. Sometimes the problem starts in the lower back. The spinal cord and its branching nerves carry messages between your brain and your legs. As we age, changes in the spine can narrow the spaces around those nerves. This condition is often called lumbar spinal stenosis. When the nerves are compressed or irritated, symptoms can travel into the buttocks, thighs, calves, or feet. You may experience cramping, aching, burning, tingling, numbness, heaviness, or weakness. The pattern often provides an important clue. Nerve-related leg pain may become worse during standing or walking. Some people notice that it improves when they sit down or lean slightly forward, such as when pushing a shopping cart. Mayo Clinic notes that nerve compression in the spine can produce cramp-like pain that worsens with walking and may improve when the person bends forward. This is different from a simple nighttime calf cramp. A normal cramp usually involves a muscle becoming visibly or palpably tight for a short period. Nerve compression may create pain, heaviness, or abnormal sensation that follows a more persistent pattern. So what should you do? If your symptoms repeatedly appear when standing or walking, involve numbness or weakness, or improve when leaning forward, arrange a medical assessment. Your clinician may examine your strength, reflexes, sensation, walking pattern, back movement, and circulation. Treatment depends on the cause and may include targeted physiotherapy, activity changes, medication, or further imaging when clinically appropriate. Seek urgent care if back or leg symptoms are accompanied by a sudden loss of bladder or bowel control, numbness around the groin, or rapidly worsening leg weakness. Those are not symptoms to manage with stretching videos or supplements. Now we reach a circulation problem that is commonly mistaken for an ordinary cramp. Number 2. Peripheral Artery Disease. Imagine that your calf feels normal while you are sitting. You begin walking. After roughly the same distance each time, the calf starts to tighten, ache, or burn. You stop and rest. Within a few minutes, the discomfort improves. Then you walk again, and the pain returns. That pattern is not typical of a random nighttime muscle cramp. It may indicate peripheral artery disease, often abbreviated as PAD. PAD occurs when arteries carrying blood to the legs become narrowed or blocked, most commonly because of atherosclerosis. During rest, the reduced blood supply may be enough, but when the muscles work, they require more oxygen-rich blood. If narrowed arteries cannot meet that demand, pain develops. The classic symptom is called intermittent claudication: aching, cramping, burning, fatigue, or discomfort in the calf, thigh, or buttock during walking or climbing stairs, which improves after resting. Other warning signs can include a foot that feels cooler than the other, slow healing wounds on the feet or toes, skin color changes, reduced hair growth on the leg, slow growing toenails, or pain in the foot even while resting in advanced disease. The risk is higher in people with a history of smoking, diabetes, high blood pressure, high cholesterol, increasing age, or disease affecting arteries elsewhere in the body. PAD matters not only because of the leg. Atherosclerosis in the leg arteries can indicate a higher risk of disease in the arteries supplying the heart and brain. The American Heart Association notes that people with PAD face increased risks, including heart attack and stroke. If your pain reliably begins with walking and improves with rest, tell your healthcare professional exactly that. Do not describe it only as "my legs hurt." Explain how far you can walk before it begins, where the discomfort occurs, how long it takes to improve after stopping, whether one foot is colder, and whether you have any wounds that are not healing. A clinician may compare blood pressure at your ankle with blood pressure in your arm, using a test known as the ankle brachial index. Further testing depends on the findings. Do not dismiss this pattern as normal aging. Early recognition can lead to treatment that protects your mobility and cardiovascular health. And now we reach the final cause, the one that requires a completely different response. Number 1. A possible blood clot. A deep vein thrombosis, or DVT, is a blood clot that develops in a deep vein, commonly in the lower leg, thigh, or pelvis. A DVT does not always cause symptoms, but when symptoms do occur, they typically affect one leg and may include swelling, pain or tenderness, warmth, redness or discoloration. This is not something to massage aggressively. It is not something to treat with potassium, and it is not something to watch for several weeks while hoping it disappears. Part of the clot can break away and travel to the lungs, causing a pulmonary embolism. Warning signs of a pulmonary embolism may include sudden difficulty breathing, chest pain that worsens with a deep breath or cough, a faster or irregular heartbeat, coughing up blood, lightheadedness, or fainting. Those symptoms require immediate emergency medical help. Risk can increase after recent surgery, hospitalization, long periods of immobility, extended travel, major injury, certain cancers, previous blood clots, estrogen-containing medication, and increasing age. But a clot can occur without an obvious explanation. The important difference is the pattern. A typical nighttime cramp tightens suddenly and then releases. A possible DVT may cause ongoing one-sided pain accompanied by swelling, warmth, tenderness, or color change. Do not attempt to diagnose the difference entirely at home. Seek prompt medical evaluation when those signs appear. What to do during an ordinary leg cramp? Now that we have covered all 7 causes, let's make the immediate response simple. When a typical calf cramp begins, stop what you are doing. Gently straighten the knee. Pull your toes upward toward your shin. Massage the calf gently. If you are stable, stand carefully and place weight through the leg. Breathe slowly and allow the muscle time to release. Avoid bouncing or forcing a painful stretch. After the cramp ends, gentle movement and warmth may help the remaining soreness. Pain medicine will not usually stop an active cramp quickly because the cramp often ends before the medicine takes effect, although it may sometimes help later soreness when medically appropriate. To reduce recurring ordinary cramps, increase physical activity gradually. Stretch the calves regularly. Avoid remaining in one position for hours. Maintain appropriate hydration. Review medications with a clinician. And address underlying circulation, nerve, or metabolic conditions rather than relying only on supplements. When to arrange a medical appointment. Speak with a healthcare professional when cramps wake you repeatedly, happen frequently, last longer than about 10 minutes, do not improve with basic self-care, appear with numbness, come with weakness, or significantly interfere with walking and daily life. You should also arrange an assessment when pain repeatedly begins during walking and improves with rest, because that can indicate reduced arterial circulation. When to seek urgent help. Seek urgent medical attention for one-sided leg swelling, warmth, redness, or persistent tenderness, a suddenly cold, pale, or severely painful foot, rapidly worsening weakness, a foot wound with discoloration or signs of tissue damage, or severe back symptoms accompanied by loss of bladder or bowel control. Call emergency services immediately for sudden shortness of breath, chest pain, fainting, or coughing blood, because those can be signs of a pulmonary embolism. Leg cramps after 60 are common. Most are not dangerous, but common does not mean every cramp should be ignored. The pattern is what matters. A cramp after an unusually active day may be muscle fatigue. A cramp after sweating heavily may involve fluid loss. Cramps beginning after a medication change deserve a medication review. Pain with numbness or weakness may involve the nerves. Pain that appears when walking and improves with rest may involve the arteries. And one swollen, warm, painful leg may be warning you about a blood clot. Do not let fear make you assume the worst. But do not let reassurance make you overlook a clear warning sign. Pay attention to when the pain begins, what makes it stop, whether it affects one leg or both, whether the muscle actually becomes tight, and whether swelling, warmth, weakness, numbness, or skin changes appear with it. That information can help your healthcare professional distinguish an ordinary cramp from something requiring treatment. Which of these 7 causes surprised you most? Was it the medication connection, the spinal nerves, or the difference between a normal cramp, PAD, and a possible blood clot? Leave your answer in the comments. And share this video with someone over 60 who regularly wakes with painful leg cramps. Not to frighten them, to help them recognize what is common, what deserves an appointment, and what should never be ignored. Subscribe for more practical, evidence-informed conversations about staying strong, mobile, and independent after 60. Take care of your legs, keep moving safely, and remember, the location of the pain matters, but the pattern tells the real story. Everything discussed in this video is general educational information and is not personal medical advice. Do not begin supplements, increase salt, change fluid intake, or stop prescribed medication without discussing your individual circumstances with a qualified healthcare professional.